Hi all, my name is Sidra Iqbal. I am the Healthroster operational lead, and today I'm going to go through the importance of Healthroster, how effective it is, and why it's so important to be used. So why are we rolling out e-rostering and why is it so important? Why are we using e-rostering? Well, e-rostering has many benefits, which I'll explain to you later. But why are we using e-rostering? Just to be assured, we are not the only trust. So e-rostering ensures that staff are appropriately allocated to provide high quality and efficient health services. Effective e-rostering factors such as patient needs, staff needs, organisational needs, the workforce and skills required to deliver services, and workforce availability. This allows us to strategically produce effective rostering processes to provide the right balance between patient safety, cost, and efficiency used in the right way. There are 5 levels of attainment used in e-rostering systems, and this allows each NHS trust to benchmark its progress as it adopts the e-rostering software. Each level of attainment is underpinned by meaningful use of standards. These describe the processes and systems that trusts need to meet each level of attainment. And by adopting these standards, we can, as a trust, be assured that we have implemented the e-rostering system and processes necessary to achieve productivity gains. The NHS clinical workforce has the skill, competence, and the compassion to deliver world-class patient care. And as recommended by Lord Carter, the meaningful use of workforce deployment software can ensure that these qualities are deployed to the best effect across all clinical professions in all healthcare settings. So improved operational productivity. This is us working towards the guidelines set by NHS England and Lord Carter. The improved experience of care. By utilising our workforce and measuring productivity, we can improve the experience of care we provide to our patients. Improve staff experience, we can improve staff morale, and this will be increased by the increased productive use of these systems by measuring trends and patterns of unfair rostering. And we can improve value with more engaged staff and increased employee engagement. Employees will be more productive at work and contribute to the improved value for resource. So what are some of the benefits of using this system? Well, the system allows you to manage your workforce electronically. This means that if you are a roster creator or roster approver, you will have access to our e-rostering system called Healthroster. This will allow you to manage the time and attendance and the rosters of your team. This also means that you won't have to produce any paper timesheets because all your enhancement will be picked up electronically, and any absences you will not need to complete any change forms because this will be fed through automatically. So any sickness or any enhancements will all be fed through automatically at the end of each month. But what this does mean is that you need to ensure to keep your rosters up to date on a daily basis, and most importantly, review and ensure that the information is all correct at the end of each month, so that the Healthroster team can run the payroll services for time and attendance successfully on the 4th or the 5th of each following month. The system has a tool called Roster Analyzer, which will allow you to review budget information, costs, patient safety, and efficiency versus the demand that you have on the roster. The system is beneficial because it ensures it helps to reduce temporary staffing spends. Effective rostering will mean that we will be using less bank staff, but also effective rostering means that we will be using less agency staff, in fact no agency staff, and then we'll be using bank staff because more bank staff will be available, which means that we can then look at reducing the bank staff usage overall. And we can do this by effectively monitoring rosters doing rota reviews with each department, and analysing analytical data, and looking at how we can further improve rosters, how we can further effectively roster, how we can further utilise any tools we are currently using more effectively to ensure that we are fully utilising this system to its fullest potential. Another effective feature of Healthroster is that you are able to request, book, and confirm a bank member of staff. When you are ready to publish your rosters in 6 to 7 weeks in advance, at this point you'll be able to know any colleagues who will be able to book and work a number of additional bank shifts. At this point, before you publish the rota, you'll be able to direct book any staff members who are able to do any additional work if required. Any shifts at the point of publishing the rota, staff members are not able to do any, you're unable to fill any vacant duties, then you can send these out to all trust employees to access. And any staff members who have the relevant skills required to work this bank shift will be able to direct book into these bank shifts. Any bank shifts you are unable to fill and you need the assistance of the bank office, you'll be able to contact the bank office and they will be able to try and assist in sending out a text message and also supporting you in trying to fill the bank shift required. So here is the roster timetable. Now this timetable is a guidance on ensuring that you are meeting the deadlines. So we have the 4-week roster period, which runs in a 4-week cycle. We then have the roster, when to create the rosters. These are created by my team in the Healthroster team. So they are created in 3 months in advance. So this gives you and your team enough time to request any duties or unavailabilities if this is applicable in your area. 6 to 7 weeks in advance, you need to look at partially approving a rota if you are a roster creator, and 6 weeks in advance, the rota needs to be fully approved by the roster approver. Now, approving the rota happens before the rota, 6 weeks prior to the rota being worked. You're planning what the rota is going to look like. You're ensuring it's safe and effective for your patients and for your staff. You're making sure it's fair and rostered accurately to ensure it's fair for all your staff, ensuring there's an equal opportunity for all staff to work all shifts. And then we go on to the bottom of the table, which shows you finalizing a roster for pay. Now, these are dates for when the period of the roster needs to be finalized. So finalization happens after the roster is being worked to say, these are the changes made. This is actually what happened, and we're happy that these are happy with these changes, and these changes will go through to payroll. So the roster creator will go through and finalize rota, and then the roster approver will go in again and refinalize that rota. And then this needs to be done by the date shown below for each calendar pay month, so it could be paid later in the month. It also has the dates for expenses, for when the expenses claims need to be produced, when they need to be completed by the employee, and it also provides you the approval date for the managers to be approved. The system allows equal opportunities for everyone. The system has the ability to be flexible. It also has roster parameters, so rules that can be made to operationally work more effective for your department, and parameters to enhance rostering effectively. Proper governance, so we ensure that the staff data in the system is secure and is able to be accessible only for the people who require visibility to that information. E-rostering also provides transparency across all services and activities. This system also allows establishment and budget information to be updated, and also has the Safer Staffing tool linked to Healthroster to ensure we can measure acuity and dependencies. E-rostering has also contributed to the outstanding rating for CQC, and also our staff survey. We are trying to improve the way our staff work and providing more flexibility by requesting shifts. Half of your shifts, the ability to request half of your shifts prorated is a huge achievement for the trust, meaning that you can plan your life around work, and if you have particular appointments or childcare issues, you can request days off or request certain days that you prefer to work. The system allows you to do that. The system provides equality, diversity and inclusion, ensuring that staff are treated fairly and equally. The system, if your ward is applicable, you will be allowed to request particular days off and particular shift you like to work during that roster period. Not only this, we are able to pick up any trends where staff are favoritized. If there's a certain member of staff who is receiving all the weekend shifts or the night shifts, we will easily be able to pick this up through trends. And we have also added rules into the system where 1 weekend per 4 weeks for each member of staff. So these things will be highlighted through the rosters by the shifts going orange. And as band sixes and roster creators, you will start to learn the system and the rules and how to roster effectively. So you would see that if someone doesn't have a flexible working agreement, you would start to learn the patterns to assign 2 long days with 2 long days off at least. And if you're assigning a staff member of nights, if you're going to assign a staff member 3 or 4 blocks of nights, you will know to assign them 3 or 4 nights off, and creating that fairness and a pattern for all members of staff, ensuring that all staff have an equal number of shifts. And again, this is with the bank work. Anyone who is seeking to fulfill any extra bank work, the self-bank booking service, when the shifts go out for all employees to book shifts, this will give an opportunity for all employees to have the opportunity to go in and book a shift rather than it being allocated to a particular favourite member of staff. What does this mean? It means that more clinical time is spent on clinical duties. What we're trying to do is make this so easy to use that you are spending more time on the rosters and more time doing clinical work, and the system will allow you to do that, because it will allow you to also roster effectively, and it will tell you where you are rostering incorrectly. It allows better management of workforce, as well as savings where we can reduce a number of bank and agency spends by effectively utilising rosters, and ultimately effective utilising the workforce as a whole. The system allows us to produce analytical data that we can amalgamate with other data, and we are able to produce trends, and we are able to see trends of sickness and annual leave amalgamated together, and if staff hours are being utilised accurately. This helps us at a high level to produce reports and see where we can further improve processes to help you to improve your services.